Psychological disorders list. Introduction. Psychological disorders, also known as mental disorders, are patterns of behavior or mental processes that cause significant distress or impairment in social, occupational, or other important areas of functioning. These disorders encompass a wide range of conditions that affect mood, thinking, and behavior. Understanding these disorders is crucial for diagnosis, treatment, and support. This comprehensive guide will explore various psychological disorders, their symptoms, causes, and treatment options. Anxiety disorders. Anxiety disorders are among the most common mental health conditions. They include disorders that share features of excessive fear and anxiety and related behavioral disturbances. Generalized anxiety disorder, GAD. Symptoms. Persistent and excessive worry about various aspects of life, work, health, social interactions. Restlessness or feeling on edge. Fatigue. Difficulty concentrating. Irritability. Muscle tension. Sleep disturbances. Causes. Genetic predisposition. Brain chemistry, imbalances in neurotransmitters such as serotonin and norepinephrine. Environmental factors, stressful life events, trauma. Treatment. Cognitive behavioral therapy, CBT. Medications, antidepressants, benzodiazepines. Lifestyle changes, regular exercise, healthy diet, adequate sleep. Panic disorder. Symptoms. Recurrent unexpected panic attacks. Intense fear or discomfort reaching a peak within minutes. Palpitations, sweating, trembling, shortness of breath. Feelings of choking, chest pain, nausea. Fear of losing control or dying. Causes. Genetic factors. Neurobiological abnormalities, dysregulation of the fight or flight response. Environmental stressors. Treatment. CBT, particularly exposure therapy. Medications, SSRIs, SNRIs, benzodiazepines. Breathing exercises and relaxation techniques. Social anxiety disorder, social phobia. Symptoms. Intense fear of social situations where one may be scrutinized by others. Fear of embarrassment or humiliation. Avoidance of social interactions. Physical symptoms, blushing, sweating, trembling. Causes. Genetics. Early traumatic social experiences. Dysfunctional beliefs about social performance. Treatment. CBT with a focus on exposure therapy. Medications, SSRIs, SNRIs. Social skills training. Mood disorders. Mood disorders involve disturbances in a person's emotional state, which affect their daily functioning. Major depressive disorder, MDD. Symptoms. Persistent feelings of sadness or emptiness. Loss of interest in activities once enjoyed. Changes in appetite and weight. Sleep disturbances. Fatigue or loss of energy. Feelings of worthlessness or excessive guilt. Difficulty concentrating. Recurrent thoughts of death or suicide. Causes. Genetic factors. Neurotransmitter imbalances, serotonin, norepinephrine, dopamine. Life events, trauma, loss, major changes. Treatment. Antidepressant medications, SSRIs, SNRIs, tricyclic antidepressants. Psychotherapy, CBT, interpersonal therapy. Electroconvulsive therapy, ECT, for severe cases. Bipolar disorder. Symptoms. Periods of depression alternating with episodes of mania or hypomania. Manic symptoms, elevated mood, increased activity, reduced need for sleep, grandiosity, racing thoughts, impulsive behavior. Depressive symptoms, same as MDD. Causes. Genetic predisposition. Neurochemical imbalances. Stressful life events. Treatment. Mood stabilizers, lithium, valproate. Antipsychotic medications. psychotherapy, CBT, psychoeducation. Obsessive-compulsive and related disorders. These disorders are characterized by obsessive thoughts and compulsive behaviors. Obsessive-compulsive disorder, OCD. Symptoms. Obsessions, intrusive, unwanted thoughts causing distress. Compulsions, repetitive behaviors or mental acts performed to reduce distress. Causes. Genetic factors. Brain structure and functioning abnormalities. Environmental factors, stress, trauma. Treatment. CBT, especially exposure and response prevention, ERP. Medications, SSRIs. Deep brain stimulation, DBS, for treatment-resistant cases. Body dysmorphic disorder, BDD. Symptoms. Preoccupation with perceived flaws in physical appearance. Repetitive behaviors, mirror checking, excessive grooming. Significant distress and impairment in daily functioning. Causes. Genetic predisposition. Neurobiological factors. Cultural and societal pressures. Treatment. CBT. Medications, SSRIs. Psychoeducation and support groups. Trauma and stressor-related disorders. These disorders develop following exposure to a traumatic or stressful event. Post-traumatic stress disorder, PTSD. Symptoms. Re-experiencing the traumatic event, flashbacks, nightmares. Avoidance of reminders of the trauma. Negative changes in thoughts and mood. Increased arousal, hypervigilance, irritability. Causes. Exposure to severe trauma, combat, assault, disaster. Genetic vulnerability. Neurobiological factors, changes in the brain structure and function. Treatment. Trauma-focused CBT. Eye movement desensitization and reprocessing, EMDR. Medications, SSRIs, SNRIs. Acute stress disorder. Symptoms. Similar to PTSD but occur within a month of the traumatic event. Severe anxiety and dissociative symptoms. Intrusive memories and avoidance behaviors. Causes. Exposure to trauma. Individual vulnerability factors, previous trauma, mental health history. Treatment. Short-term CBT. Supportive therapy. Medications, anxiolytics for short-term use. Dissociative disorders. Dissociative disorders involve a disruption or discontinuity in the normal integration of consciousness, memory, identity, emotion, perception, body representation, motor control, and behavior. Dissociative identity disorder, DID. Symptoms. Presence of two or more distinct personality states. Gaps in memory for everyday events, personal information, or traumatic events. Distress and impairment in social or occupational functioning. Causes. Severe and prolonged trauma during childhood, physical, sexual, emotional abuse. Lack of supportive environment during traumatic experiences. Treatment. Long-term psychotherapy, trauma-focused therapy. Hypnotherapy. Medications to manage comorbid symptoms, depression, anxiety. Depersonalization/derealization disorder. Symptoms. Persistent or recurrent experiences of depersonalization, feeling detached from oneself, or derealization, feeling that the external world is unreal. Distress and impairment in daily functioning. Causes. Severe stress or trauma. Neurobiological factors, abnormalities in brain function. Psychological factors, coping mechanisms. Treatment. Psychotherapy, CBT, psychodynamic therapy. Medications, antidepressants, anti-anxiety medications. Stress management techniques. Somatic symptom and related disorders. These disorders are characterized by an excessive focus on physical symptoms, which cause significant distress and impairment. Somatic symptom disorder. Symptoms. Multiple, current, somatic symptoms that are distressing or result in significant disruption of daily life. Excessive thoughts, feelings, or behaviors related to the symptoms. Causes. Genetic predisposition. Childhood adversity, abuse, neglect. Cognitive factors, catastrophic thinking about symptoms. Treatment. CBT. Medications, antidepressants. Psychoeducation and support. Illness, anxiety disorder, hypochondriasis. Symptoms. Preoccupation with having or acquiring a serious illness. High level of anxiety about health. Excessive health-related behaviors, checking for signs of illness, or maladaptive avoidance. Causes. Genetic and psychological factors. Misinterpretation of normal bodily sensations. Health-related experiences in early life. Treatment. CBT. Medications, SSRIs. Stress management and relaxation techniques. Feeding and eating disorders. These disorders involve preoccupation with food, body weight, and shape, leading to unhealthy eating behaviors. Anorexia nervosa. Symptoms. Restriction of energy intake leading to significantly low body weight. Intense fear of gaining weight. Distorted body image and undue influence of body weight on self-evaluation. Causes. Genetic predisposition. Cultural pressures for thinness. Psychological factors, perfectionism, low self-esteem. Treatment. Nutritional rehabilitation and weight restoration. Psychotherapy, CBT, family-based therapy. Medications, antidepressants for comorbid conditions. Bulimia nervosa. Symptoms. Recurrent episodes of binge eating. Inappropriate compensatory behaviors, vomiting, laxative use, excessive exercise. Self-evaluation unduly influenced by body shape and weight. Causes. Genetic and environmental factors. Socio-cultural influences. Psychological factors, impulsivity, emotional dysregulation. Treatment. CBT. Medications, antidepressants. Nutritional counseling. Personality disorders. Personality disorders are enduring patterns of behavior, cognition, and inner experience that deviate markedly from the expectations of the individual's culture, leading to distress or impairment. Borderline personality disorder, BPD. Symptoms. Unstable interpersonal relationships. Intense and unstable emotions. Impulsive behaviors. Chronic feelings of emptiness. Fear of abandonment. Causes. Genetic predisposition. Childhood trauma or neglect. Brain structure and function abnormalities. Treatment. Dialectical behavior therapy, DBT. Medications, mood stabilizers, antipsychotics. Psychoeducation and support groups. Antisocial personality disorder, ASPD. Symptoms. Disregard for and violation of the rights of others. Deceitfulness, impulsivity, irritability, and aggressiveness. Lack of remorse for actions. Causes. Genetic factors. Environmental influences, abuse, neglect. Neurobiological factors, differences in brain functioning. Treatment. Psychotherapy, CBT. Medications for comorbid conditions. Behavioral interventions. Neurodevelopmental disorders. These disorders typically manifest early in development and feature developmental deficits that produce impairments of personal, social, academic, or occupational functioning. Autism spectrum disorder, ASD. Symptoms. Deficits in social communication and interaction. Restricted, repetitive patterns of behavior, interests, or activities. Sensory sensitivities. Causes. Genetic factors. Neurobiological abnormalities. Environmental influences. Treatment. Behavioral interventions, applied behavior analysis. Speech and occupational therapy. Medications for managing symptoms. Attention deficit/hyperactivity disorder, ADHD. Symptoms. Inattention, difficulty sustaining attention, forgetfulness. Hyperactivity, excessive fidgeting, inability to stay seated. Impulsivity, interrupting others, difficulty waiting. Causes. Genetic predisposition. Neurobiological factors, differences in brain structure and function. Environmental influences. Treatment. Stimulant medications, methylphenidate, amphetamines. Behavioral therapy. Psychoeducation and support for families. Conclusion. Psychological disorders are complex and multifaceted, affecting millions of people worldwide. Understanding the various types of disorders, their symptoms, causes, and treatment options is essential for providing effective care and support. While the challenges posed by these disorders are significant, advancements in research and treatment continue to offer hope for improved outcomes and quality of life for those affected. If you enjoyed this video, don't forget to hit that subscribe button and join the Ni655 family. Give us a thumbs up if you liked the content, and make sure to click the bell icon so you never miss an update. Thanks for watching, and stay tuned for more awesome videos.